When treating a concussion, there are several stages to make a full return to sport and school. Contrary to previous beliefs that rest, avoidance of screen time, and sitting in dark rooms are the initial stages of recovery, we are now seeing that early introduction to physical activity, even as early as 24 hours after the injury, can be beneficial to recovery. This early physical activity should have no risk of you sustaining another hit to the head, but can be as simple as walking, stationary bike riding, or bodyweight activities. You can also concurrently return to school or work based on how your symptoms react as guided by your doctor or therapist. Depending on your tolerance to this activity, you may be able to progress to moderate levels of general physical activity, such as higher intensity cardio, weightlifting, and circuit style training. An example of a circuit that may be appropriate is 30 seconds of inchworms, 30 seconds of med ball lateral lunges, 30 seconds of squat jumps, and 30 seconds of med ball rotations. This circuit not only taxes your cardiorespiratory system, which has been shown to be helpful in concussion recovery, but can also tax your vestibulo-ocular and cervical systems. What this means is how your inner ears, eyes, neck, and brain all talk to each other, which will also be assessed and treated when performing concussion therapies. These non-specific activities can progress toward more specific activities such as shots, sprawls, hip outs, all while minimizing the risk of further blow to the head. Once you have passed appropriate timelines and appropriate testing, you may progress to light wrestling with partners you trust. Meaning, don't just go right into tournaments or wrestling for your spot back while you were gone. Start with someone you know, you can be responsible with, and assess your tolerance, and you can progress back to higher level of wrestling from there. Now, none of this is meant to be complete medical advice, and if you are suspected of having a concussion, you should seek medical care prior to returning to your sport. Again, this is Dr. Chris Soreo, and thank you for watching and listening to Concussions in Wrestling.